My name is Melissa Sosinski, and the topic of my speech is hospice. Hospice to me means support, compassion, and understanding. My grandmother was diagnosed with terminal cancer in 2003. My husband and my family was told by doctors that she would only make it about 6 months. For my family, they thought put her in a nursing home. But for my husband and I, we knew that she would want to die in the comfort of her own home, surrounded by her family members. Thanks to hospice, we were able to provide her with the care that she wanted, and the support and encouragement of hospice and their volunteers made it easier for us too. My father was diagnosed with bone cancer in the year 2012. We again called upon hospice. They helped us to provide him with the care that he needed, and he was able to pass in the comfort of his home with his family members and his friends surrounding him. Hospice changed both my family members' lives and ours, as they were compassionate towards us and them. They supported the whole family, even long after they had passed. What is hospice? The word hospice means a place of shelter and rest for the weary or ill. According to the National Hospice and Palliative Care Organization, History of Hospice, in the year 1948, Dr. Dame Cicely Saunders created hospice at St. Christopher's Hospice in London. In 1963, he came to the United States and presented Yale University with hospice and what it entailed. And that was the beginning of what hospice is today. According to WebMD 2011, hospice is pain management to care for the dying without artificial medical assistance. The services help patients and their family members cope with a terminal illness. WebMD states that the caregivers mainly come into the patient's home to keep them in a family environment. According to WebMD, the services that are provided to patients and their family members are medical care, pain and system control, access to hospice 24 hours a day, 7 days a week. They provide medical supplies and equipment, counseling and social support, and psychological and emotional support. They help with guidance with issues that might be difficult but are very normal during this time and are a part of life. They provide respite for the family members and the caregivers to give them a break. Volunteers come in and they help with meals and they help run errands. They provide support and counseling from family members after their loved ones have passed. Who is eligible for hospice? WebMD states that patients that have been diagnosed with an incurable condition, and the physician states that their life expectancy is 6 months or less. If the patient lives longer, they can still stay on hospice. If the patient wants to stop receiving hospice because they get better, they can do so. If you need to go to the hospital, you can do that on hospice. I know what you're thinking. How can I afford this type of care at home? Medicare, Medicaid, and most private insurances do pay for hospice. According to WebMD, hospice programs help patients to find if they are eligible for coverage for hospice services. Now that you know about hospice and how it can help you or a family member live their last days in comfort of their own home with their loved ones, would you consider hospice? The support you and your family will receive from hospice will help you and your family cope and feel supported during this hard time. I know personally, without the support of hospice, I could have never been able to have my grandmother and father with me during their final days.